to the channel The Nurse. Here we are discussing about Navodaya Vidyalaya nursing preparation questions and answers with their rationales. This is our 7th part of Navodaya Vidyalaya preparation question set. So if you are not watched the previous video, please watch our previous video. We have kept in a separate playlist. So previous year questions also included in that playlist. Navodaya Vidyalaya Nursing Exam Questions and Answers. You can go and check that playlist in our channel. So here we are going to video topic. Before that, if you are not subscribed to our channel, please subscribe. So we are moving to questions. Navodaya Nursing Exam Preparations question set 7. First question, which of the following medical order is expected for reducing fluid volume excess? Which of the following medical order is expected for reducing fluid volume excess? Low sodium diet, daily serum electrolytes, monitor intake output, elevation of head end. So, which of the following medical order to reduce fluid volume excess you will expect? So please try to answer, then only we can make this session active session. Please try to answer. Whether it is right or wrong, no issue. Please try to answer, then only you will learn. It is easy question. Correct answer is option A, low sodium diet. Why low sodium diet for reducing fluid volume excess? Because sodium controls fluid balance in our body. Sodium controls fluid balance in our body and maintain blood volume. And also it helps to maintain blood pressure. So eating too much sodium may raise blood pressure and cause fluid retention. In that case, we need to reduce sodium intake, and in that way we can reduce the fluid volume excess, because the fluid retention will not be there. If sodium is more, means it will attract fluid and the fluid retention will be more. By reducing sodium, we can reduce the fluid volume excess. If you are having more sodium, it will increase the fluid excess and it will causes swelling. And daily serum electrolytes, monitor intake output are also required, but main intervention is by reducing low sodium diet. Sometimes we will provide foot and elevation. Foot and elevation, why we are giving? Sometimes there will be a pooling of this increased fluid in our dependent part, that is in lower extremities. So in that case, we will elevate the legs to mobilize the pooled excess volume of blood, fluid into our heart, and then it will go to kidneys and excrete through urine. So these are the main measures. Or sometimes as a medical management, we will give diuretics to excrete the excess fluids. These are the some interventions for fluid volume excess. Main thing is we can reduce the sodium diet. So next question, which of the following is an early indicator of deterioration of patient's neurological status? Which of the following is an early indicator of deterioration of patient's neurological status? Widening pulse pressure, decreased pulse rate, dilated fixed pupils, decrease in level of conscious or LOC. So, important term is early indicator. Correct answer is option D, that is decreased level of consciousness. Early indication of patient's deterioration in the neurological status, that is decrease in the level of consciousness, that we are assessing through Glasgow Coma scale. We will assess the motor, eye response, verbal response, and we can assess the decrease in the level of consciousness in GCS. So widening pulse pressure, decreased pulse rate, etc. are seen in increased ICP, that is Cushing triad, that is widened pulse pressure, decreased pulse rate, and that is bradycardia and irregular respirations. These three symptoms are known as Cushing triad, that is seen in increased ICP. Dilated fixed pupil also, that will seen in the increased ICP condition because of compression on the optic nerve. It will cause damage to the optic nerve and other nerves that controlling the muscles of the eye, muscles of the pupil. So dilated fixed pupil also, it is a late sign actually, that is increased ICP. So I think it is clear. Cushing triad we discussed here. In Cushing triad, that is increased ICP, there will be three main symptoms are there. That is widened pulse pressure, bradycardia, and irregular respirations. Dilated fixed pupil is it is develops because of increased ICP, that will compress the motor neurons, motor cranial nerves, that helps to move the pupils. So here early indicator, that is decreased level of consciousness. Next question, ECG changes due to hyperkalemia. It is a repeated question. ECG changes due to hyperkalemia. Tall peaked T wave, prominent U wave, widened QRS complex, prominent P wave. Third question, it is easiest question. It is a very common and repeated questions. Don't make mistake here. ECG changes due to hyperkalemia. I told you, don't make a mistake here. Repeated question, hyperkalemia ECG changes. Correct answer is option A, tall peaked T wave. Tall peaked P wave is the specified feature of ECG changes in hyperkalemia, but there will be sometimes widened QRS also we can see, but it is not common. But tall peaked T wave is a peculiar feature of hyperkalemia. Tall peaked T wave, it is a peculiar feature of hyperkalemia. Same time, prominent U wave, it is seen in hypokalemia. Prominent U wave, it is seen in hypokalemia. Same time, inverted U wave. Inverted means downside. Inverted U wave is seen in myocardial ischemia or MI condition also. We can see inverted U wave. But upside U wave, that is prominent U wave, it is in hypokalemia. Inverted U wave is myocardial ischemia. Widened QRS, it is usually seen in bundle branch block, right or left bundle branch block, or if a person is having a pacemaker, in that case also widened QRS complex will be there. And hyperkalemia I already told, but it is not seen in all the hyperkalemic cases, but it can seen in hyperkalemia also. But common feature in hyperkalemia, that is tall peaked T wave, it is there in option, means you need to give your answer, that is tall peaked T wave, because widened QRS can be seen in other condition also. Same time, prominent P wave. Prominent P wave, it is seen in atrial enlarged atria, because SA node is producing this P wave. The prominent P wave, that is the height of the P wave, it is higher than the normal one, means it is due to atrial enlargements. Same time, there will be inverted P wave. Inverted P wave, that is usually seen in the case of ectopic atrial rhythm. Ectopic atrial rhythm means the rhythm is initiating other than SA node. The heart rhythm is initiating other than SA node. That condition we can see inverted P wave, downside curve. Inverted P wave we can see in ectopic atrial rhythm, that is the rhythm is originating other than SA node. Normally the rhythm is initiating from SA node, but if it is arising other than SA node, that is known as ectopic atrial rhythm. In that case we can see inverted P wave. So I think it is clear. Tall peaked T wave, it is a peculiar feature of hyperkalemia. Prominent U wave, it is seen in hypokalemia. Widened QRS complex we can see it either in a bundle branch block. If person is having pacemaker, in that condition also widened QRS complex you can see. And hyperkalemia case also we can see widened QRS complex. And same time, prominent P wave, that is enlarged atrium, in that condition we can see the prominent P wave. Inverted P wave we can see in the case of atrial ectopic atrial rhythm, that is initiating other than the SA node. Fourth question, the most common acid-base imbalance associated with renal failure. The most common acid-base imbalance associated with renal failure: respiratory acidosis, metabolic acidosis, respiratory alkalosis, metabolic alkalosis. The most common acid-base imbalance seen in renal failure. A similar kind of question we have discussed in previous video, that is ICU nursing questions and answers. In that video we have discussed a similar kind of question. Here correct answer is that is, everyone knows that answer, that is metabolic acidosis. Metabolic acidosis is usually seen in the case of renal failure. Why it is happening? Because kidney function, it will reduce in the case of renal failure. Kidney helps to produce bicarbonate. Bicarbonate is the buffer system. Metabolic acidosis means the level of bicarbonate is lower than the normal. The normal level of bicarbonate is, that is 22 to 26. In metabolic acidosis, the bicarbonate level is less than 22. So in that condition, that is because of kidney is producing inadequate amount of bicarbonate. That is one reason. And the second reason is impaired ammonia excretion. Impaired ammonia excretion also another reason. That excretion is ammonia excretion is usually happening through feces and urine. But in renal failure case, the ammonia excretion is impaired because of the kidney is not able to excrete that normal amount of ammonia through urine. So that is another case, impaired ammonia excretion. And that third cause, one is the decreased production of bicarbonate, and second cause is impaired ammonia excretion, and the third cause in renal failure, that is reabsorption of bicarbonate. Reabsorption of bicarbonate also not doing in the renal failure case. Reabsorption of bicarbonate is affected, and production of bicarbonate also not producing adequate amount bicarbonate, and the third, that ammonia excretion also impaired. So these three reasons, in renal failure case there will be metabolic acidosis. Fifth question, a patient with appendicitis is at risk of developing. A patient with appendicitis is at risk of developing hemorrhage, pulmonary edema, peritonitis, bowel obstruction. A patient with appendicitis is at risk of developing. It is an easy question. Most of you given correct answer only. That is peritonitis. How peritonitis is occurs in appendicitis condition? How peritonitis occurs in appendicitis? So anyone can explain how this inflammation occurs? Sonali. Yeah, Loga Nayagi given correct answer because of the infection, the appendix will get rupture. So after rupturing, the infected particles will lodge into the peritoneum and it will infect the peritoneal cavity. So that is how the peritonitis occurs in appendicitis. So the major complication of appendicitis, that is peritonitis. Because of that only, in the case of appendicitis, we need to do the removal of appendectomy in emergency basis. To prevent peritonitis, we will do appendectomy surgery in an emergency basis. Otherwise, it will cause peritonitis and this peritonitis will spread into whole abdominal organs. Then finally, it will leads to sepsis. Sixth question. A patient describes his symptoms as light flashes, floaters and ring in the field of vision. This is due to. A patient describes his symptoms as light flashes, floaters and ring in the field of vision. This is due to detaching retina, glaucoma, cataract, keratitis. The patient describes his symptoms as light flashes, floaters and ring in the field of vision. Options: detaching retinal detachment, glaucoma, cataract, keratitis. Correct answer is these are the symptoms of detaching retina. The light flashes, floaters and rings in the field of vision are symptoms of detaching retina. Retinal detachment happens when a part of the eye that is responsible for creating image pulls away from the back of the eye. So in the case of eye, the images are that through pupil that light is coming and images are creating at back posterior part of the eye. In that case, the images are creating at retina. So in that case, retinal detachment, the retinal layer, inner side layer, that will pulls away from the eye, and it will cause these light flashes, floaters and ring in the field of vision in initial stage, and finally if immediate treatment is not taken, means the finally loss of vision will be there in permanently. So that is a important of retinal detachment. If once vision is lost, means in retinal detachment it will not come back. So emergency treatment is required in the case of retinal detachment is diagnosed. Glaucoma means it is a loss of peripheral or side vision. In that case, halos around the light, vision loss, tunnel vision, pain on the affected eye are the main features of the glaucoma. Glaucoma means loss of peripheral or side vision. In that case, the patient will complain halos around the light, vision loss, tunnel vision and pain on the affected eye. So same time in the case of cataract means it will start from mild eye blurriness and cloudiness. So in the cataract, the symptoms will develop in a gradual way. That is starting from mild blurriness and cloudiness and early sensitivity to light. They cannot look into the light. So these are the symptoms of signs and symptoms of cataract. And in the case of keratitis, it is an inflammation, and the main symptoms is the pain and redness. Pain and redness is the main symptoms of keratitis. Detaching retina, we have discussed it. That is light flashes, floaters, and ring in the field that has peculiar features of detachment of retina or retinal detachment. Glaucoma means halos around the light, and vision loss, tunnel vision, pain on the affected eyes. These are the symptoms of glaucoma. Cataract means it is a gradual symptoms will be there, blurriness, and same time cloudiness will be there in the initial period, and the same time the eye sensitivity towards light. These are the symptoms of cataract. In keratitis, redness and pain will be there. Seventh question. Immediately after TURP, that transurethral resection of prostate gland, the continuous bladder irrigation outflow appears to be. Immediately after TURP, transurethral resection of prostate, the continuous bladder irrigation outflow appears to be clear, dark red, light pink, bright red. Immediately after TURP. Correct answer is option C, that is light pink. Immediately after TURP, the bladder irrigation, the urine color will be a light pink color. Because immediately after TURP, we will start continuous bladder irrigation. In that irrigation, the blood clots and that is small bleeding points and all will cause the urine color will be light pink. And till urine get clear, till that time we will do the irrigation. So usually 40 to 72 hours urine become clear, and till that time that urine irrigation will be there. So main purpose of doing bladder irrigation is actually to remove the clot formation and retention, urinary retention, because of these clots will block the urine. So because of that, to remove the clot formation and to prevent the blockage, urinary blockage. Next question. The correct action that a patient with blunt chest injury performs while using an incentive spirometer is. The correct action that a patient with blunt chest injury performs while using an incentive spirometer is: exhales normally, takes rapid shallow breaths, seal the mouthpiece during exhalation, tilt the incentive spirometer. It is quite confusing. So answer carefully. The correct action that a patient with blunt chest injury performs while using an incentive spirometer. The same incentive spirometer question was seen in our previous video also. So answer here. Correct answer here, that is seals the mouthpiece during exhalation. It is nothing with the blood trauma chest. While performing spirometer, the patient should seal the mouthpiece during the exhalation. Then otherwise the air will come from outside, so it will not give adequate result. So the seals the mouthpiece with during exhalation, and that will improve the that lung capacity. So how to use that incentive spirometer, I will briefly explain. First, the patient need to sit up and hold the device. Then place the mouthpiece of the spirometer in your mouth and make your with a good seal. Otherwise, it will leak or it will take air from outside. So it should be prevented. Then breathe out, exhale normally, and breathe in, that is slowly. While breathe in, the ball will go up. So that you need to make a target. First day, you can first initial days you can keep first ball, and next target you can keep the 2 balls, then 3 balls. So there will be maximum 3 balls. So 3 balls has to go up. Then it means your lung expansion is improved. So one by one you need to keep the target for the blood trauma, chest injury patients, or any other kind of respiratory disorder patients. And the prescribed, actually typically we will tell the patient to do 10 breaths in an hour. So in an hour, usually 10 breaths the patient can perform. Every hour patient can do the 10 breaths, and it will gradually improve the lung expansion. Ninth question: which of the following symptom would be indicative of dumping syndrome? Which of the following symptom would be indicative of dumping syndrome? Hunger, diaphoresis, melena, heartburn. Ninth question answer: hunger, diaphoresis, melena, heartburn. Correct answer is diaphoresis. Before explaining the answer, I will explain about what is dumping syndrome. Dumping syndrome due to the upper GI surgery, or for bariatric purpose, the patient's part of the stomach or whole stomach and initial part of the duodenum will be removed. Sometimes part of the stomach or entire stomach with the part of the duodenum will be removed in surgery, and that will cause the emptying of the food directly into the intestine, small intestine, and that will cause a surge of glucose, because in stomach what is happening, the food particles is mixes with the gastric juices, and the concentration of glucose will be low. But in the case of dumping syndrome, the food particles directly reaches into small intestine, that will causes a surge of glucose, carbohydrate material, and it will stimulate the production of large amount of insulin together. This large amount of insulin will cause immediate hypoglycemia. Immediate hypoglycemia will cause because of this to reduce the glucose level. But this glucose level become lower than the normal level, and it will go to hypoglycemia, and the symptoms of hypoglycemia will be there. One of the symptom is diaphoresis. That is why diaphoresis is common in dumping syndrome. Other symptoms include vomiting will be there, and sometimes abdominal pain, and the blood, the air-filled feeling. These are the symptoms of dumping syndrome. And diaphoresis, I explained, it is because of the large amount of insulin is produced, then it will leads to hypoglycemia. Because of hypoglycemia, patients may get diaphoresis. 10th question. What is the most lethal complication after myocardial infarction? What is the most lethal complication after myocardial infarction? Cardiogenic shock, ventricular dysarrhythmias, pulmonary embolism, cardiac tamponade. Lethal complication. Correct answer is ventricular dysarrhythmias. Complications of myocardial infections includes ventricular dysarrhythmias, heart block, or sometimes congestive heart failures. In that, ventricular dysarrhythmias are very common, and if it is untreated, patient will die. That is why it is known as lethal complication. If it is untreated, patient will die, and so immediate treatment is required in the case of ventricular dysarrhythmias. That is ventricular tachycardia, ventricular fibrillation. These are the examples of ventricular dysarrhythmias. 11th question. Which type of seizure is frequently preceded by an aura? Which type of seizure is frequently preceded by an aura? Jacksonian or focal motor, petit mal or absence, grand mal or tonic-clonic seizures, or myoclonic seizures. Which type of seizure is frequently preceded by an aura? Not always, but frequently. Correct answer is grand mal seizure or generalized seizures. Grand mal seizures, or it is known as generalized seizures or tonic-clonic seizures. So before grand mal seizure or tonic-clonic seizure, patient will get some kind of indications. The seizure is coming. So that time patient may make screaming, or sometimes patient may feel some peculiar taste, or sometimes patient may get some special smells. These are the some types of aura. So in that case, patient will understand the patient is getting or the seizure is coming. So that is known as aura, the indication before the seizure. And before that, you need to understand what is generalized seizure and what is focal seizures. The seizures are divided into two types: focal seizures and generalized seizures. In focal seizures means the abnormal electric activity is happening in some focal part or some specified part of the brain. In generalized seizures, what happening? The both hemisphere of the brain is involved. The abnormal electrical activity is happening same time in the both hemisphere. That is generalized seizure. And focal seizure, that is focused in the some separate part of the brain. It originates from some part of the brain. And another some terms are there by before understanding seizures. First term is tonic. What do you mean by tonic? Tonic means, the word meaning is muscles in the body become stiff. In some cases of seizures, the patient's extremities or patient's movement will be very stiff body parts. That is known as tonic. Atonic means the muscles in the body become relaxed. So all the joints or all muscle movement control will be lost there, and that condition is known as atonic condition. The muscles in the body in a relaxed conditions. Same time myoclonic. Myoclonic means short jerking in parts in the body. that is an myoclonic seizure, or sometimes myoclonic this jerking can be happen in a normal person also. It is not a dangerous sign. No need to take any intervention or medication for myoclonic seizures. That is just jerking, like a finger movement will be there, or sometimes some muscles will be like jerking movements. You can visualize the patient become oriented in that case also. Clonic means it is a shaking. Clonic means it is a shaking or jerking of the jerking movements of the body parts. So clonic means there will be stiffness and this jerking. Both will be there. That is what grand mal seizures. It is known as tonic-clonic seizures, because there will be stiffness will be there, and same time there will be jerky movements or shaky movements of the body parts will be there. And now we will see what is Jacksonian focal seizure. Jacksonian seizures is a type of focal partial seizures, also known as simple partial seizures. So partial seizures and generalized seizures I told because partial means that is involvement of some part of the brain only. Generalized seizures means both hemisphere it is involved. Jacksonian seizure is a simple partial seizure and it means it is caused by unusual electrical activities that affects only a small area of the brain. Only a small area of the brain is abnormal electrical activity started in the small part of the brain, and in that case the persons maintain awareness during the seizure, and Jacksonian seizures are also known as Jacksonian march. Jacksonian seizures also known as Jacksonian march. Why it is called Jacksonian march? It will start in distal part of the body. The seizure activity, the jerking movements will be start from one side of the distal part of the our body, usually from our legs or fingers, and then it will extend in upward movement. Same time, same side, it will extend up to face. It is start from distal part of the body and it extends from the distal part to up to face on the same side. That is why it is known as Jacksonian march. Jacksonian march or Jacksonian seizure is a phenomenon where a simple partial seizure spread from distal part of the limb towards the ipsilateral face. Ipsilateral face means the same side of face. It will spread. So next we will see what is petit mal seizures or absent seizures. Petit mal seizure or absent seizures involve brief sudden lapse of consciousness. Here there will be a short period of loss of consciousness will be there, and they are more common in children than in adults. It occurs usually in children. Someone having absent seizure may appear to stare into space for a few seconds. Other symptoms include lip smacking. Patients will keep lips like lip smacking, like this movement will be there, or eyelid fluttering will be there, sudden movement of eyelids, and chewing motion will be there. These are the symptoms of absent seizures. But in most of the case, absent seizure, the other person cannot understand. The suddenly patients movement will be lost, and while talking the patient suddenly will stop talking, or while doing some work patient suddenly will stand still. So these are the some symptoms of absent seizures. The other person cannot understand this person is getting seizure. And the last one is myoclonic seizures. Myoclonic seizures are characterized by brief jerking spasms of muscles or muscle group. It can be seen in normal person also. So there is no treatment is required. It is a minor disorder only, myoclonic seizures. So that is about 4 options. Then 12th question. What should be the depth of chest compression during adult CPR? What should be the depth of chest compression during adult CPR? 0.5 to 1 inch, 1 to 1.5 inches, 1.5 to 2 inches, 2 to 2.4 inches. 12th question. The depth of CPR. Correct answer is option D, 2 to 2.4 inches. The depth of CPR 2 to 2.4 inches. 13th question. This is the last question from nursing subject. Which of the following complication is associated with mechanical ventilation? Which of the following complication is associated with mechanical ventilation? Gastrointestinal bleeding, immunosuppression, increased cardiac output, pulmonary embolism. Most common complication associated with mechanical ventilation. Correct answer is option A, gastrointestinal bleeding. There is a increased chance of gastrointestinal bleeding because of the stress. There is a physical stress and mental stress, and both there will be increased production of HCl, and it is also causes the injury to the mucosa. So in both cases there will be gastrointestinal bleeding charge, but it is prevented by administering H2 receptor antagonist, that is ranitidine or pantoprazole, proton pump inhibitors. So there will be another question also, why the proton pump inhibitor like pantoprazole is administered for the patients having mechanical ventilation. The correct answer is to prevent gastrointestinal bleeding. Immunosuppression is not usually having because of mechanical ventilation. In that case, there will be decreased cardiac output instead of increased cardiac output. Pulmonary embolism also not associated with mechanical ventilator. So I think it is clear, because of increased stress, there will be injury to the mucosa, gastric mucosa, and erosive esophagitis also will cause. Erosive esophagitis, that is because of regurgitation of hydrochloric acid from stomach. That is also may happen due to the mechanical ventilation. To prevent that regurgitation of HCl, we need to make the head of the bed elevated up to 45 degrees. So next we will discuss some general awareness questions. In that, first question, which of the following ministry has recently banned sharing of secret documents by its official on the internet? Which of the following ministry has recently banned sharing of secret documents by its officials on the internet? Ministry of Women, Ministry of Education, Ministry of Science, Ministry of Information and Broadcasting. Which of the following ministry has recently banned sharing of secret documents by its official on the internet? Correct answer is option D, that is Ministry of Information and Broadcasting. 15th question, that is also from general awareness. In which city the Dada Saheb Phalke International Film Festival Awards 2022 has been organized? In which city the Dada Saheb Falke International Film Festival Awards 2022 has been organized? Pune, Mumbai, Delhi, Kolkata. Correct answer is option B, Mumbai. Next question. French President Emmanuel Macron has announced military withdrawal from Mali after how many years? French President Emmanuel Macron has announced military withdrawal from Mali after how many years? 5 years, 7 years, 9 years, 11 years. Correct answer here, option C, that is 9 years. After 9 years, the French President Emmanuel Macron has announced military withdrawal from Mali. 16th question. Which initiative has recently been announced by the Government of India to improve the educational institutions in the country? Which initiative has recently been announced by the Government of India to improve the educational institutions in the country? Heal by India, Prepare India, Go India, Education by India. Which initiative has recently been announced by the Government of India to improve the educational institution in the country? Correct answer is option A, that is Heal by India. Next question. The brand has recently roped in table tennis player Manika Batra as its brand ambassador. Which brand has recently roped in table tennis player Manika Batra as its brand ambassador? Boat, Levi, Bata, Adidas. Which brand has recently roped in table tennis player Manika Batra as its brand ambassador? Correct answer is option D, that is Adidas. 18th question. Sakibul Ghani of Bihar has become the first player in cricket history to score which century on his first class debut? Sakibul Ghani of Bihar has become the first player in cricket history to score which century in his first class debut? Double century, triple century, fourth century, none of these. It is in first class cricket. Correct answer is, that is option B, that is triple century. Sakibul Ghani of Bihar has become the first player in cricket history to score triple century in his first class debut. Next question is interesting question. Which of the following diagrams indicates the best relation between women, mothers and engineers? Which of the following diagrams indicates the best relation between women, mothers and engineers? This question is from reasoning and aptitude subjects. So see the options, different options, different pictures in the options. Relation between women, mothers and engineer. The question is related to Venn diagram. So I'm giving little more time for you to answer because very few people are given correct answer here. Otherwise, someone can explain. Someone can explain, so it will be helpful for others also why they are selected this option. The relationship between women, mothers, and engineer. So, okay, anyway, I will only explain. The correct answer, that is option A. Option A is the correct answer. I will explain you. So, first we can consider all the women. The first circle is for women. This is the first circle, bigger circle. In that, inside all women, all mothers are women. So inside the mother, we can consider a smaller circle because all mothers are women. But in the same time, the engineers, there is another term, engineers. Some mothers will be engineer also. So that is why it is the first one is correct. First circle, that is for women. So inside all mothers are women. So there will be inner circle. All mothers are women. Then some mothers are engineers or some women are also engineers. So what about this picture? This picture is, there is no relation. All circles are unrelated. So it is a wrong answer. And what you mean by this B option? B option means the bigger circle. Bigger circle we can termed as it is a women. And two inner circles. So all mothers are women. That is correct. But all mothers sometimes all women are other profession also. So it is all it is incorrect here. And there is no relation between mothers and engineers. So that is why option B is incorrect. And like say the same way, option D also incorrect because all women women is a bigger one, and inside that one circle, that is maybe either mother or engineers, and inside one more circle they have given, but it is wrong because there will be some mothers will be engineers or some mothers will be doing other work also. So it this option also become incorrect here. So that is how you need to find the answer here. So I just given an idea only. So question may come like this. Next question, pointing to a photograph of a boy, Suresh said, "Is the son of the only son of my mother." How is Suresh related to that boy? Pointing to a photograph of a boy, Suresh said, "He is the son of the only son of my mother." How is Suresh related to that boy? Brother, uncle, cousin, father. You need to read the question carefully and understand, then only you can answer here. Pointing to a photograph of a boy, Suresh said, "He is the son of the only son of my mother." You need to think little bit, then only you will understand the question. If you understand question means you can answer here easily. So this will be the boy in the picture, and then in the question it is telling he is the son of the only son of my mother. Suresh is telling the boy is the only son of the he is the son of the only son of my mother. So Suresh is telling mother's only son means Suresh is the only son. Then boy will be the son of the Suresh. I think you got the uh, picture, because the boy in the photograph is the only son of Suresh's mother. Hence Suresh is the father of the boy. So correct answer will be option D, that is father. That is why I told you, please read the question carefully and understand it. Then only you can answer the question easily. So next question. The, to- the total of the ages of Amar, Akbar and Anthony is 8 years. The total of the ages of Amar, Akbar, Anthony is 80 years. What was the total of their ages 3 years ago? The total of the ages of Amar, Akbar, Anthony is 80 years. What was the total of their ages 3 years ago or 3 years before? 71 years, 72 years, 74 years, 77 years. Actually, it is an easy question. Think before answering. The total of ages of Amar, Akbar and Anthony. 3 persons are there. One more tip, those who are given option D, once again they can try. It is a wrong answer. Those who are given option D, they can do once again. They can calculate once again and give correct answer. Because here is 3 persons are there. 3 years before, you need to subtract the 3 persons age 3 years. So 3 into 3. 9 years you need to subtract from 80 years. Then what will be the answer? The answer will be 71. So I think it is become clear. So correct, the 3 member Amar A plus B plus C, that is the 80 years. So before 3 years, so minus A's age 3 years, minus B's age 3 years and minus C's age 3 years. So total 9 years. You need to subtract from 8 years. So total will be 80 minus 9. So 3 years of Amar, 3 years of Akbar, 3 years of Anthony. So like answer is 71. So next question. What is the product of all the numbers in the dial of a telephone? What is the product of all the numbers in the dial of a telephone? Options: 158480, 159450, 159480, none of these. It is a tricky question. 22nd question. It is a common question coming to the UPSC and all. So any of you attended previous UPSC questions and all, they can answer here without thinking. The correct answer is none of this. Why? Can anybody explain? No need to multiply or no simple explanation. There will be 1, 2, 3, like up to 0. After 9, there will be one button for 0. So after multiplying 0 with any number, the answer is 0 only. So 0 option is not given. That is why none of this option is correct here. If option is given 0, then 0 is the correct number. But it is not mentioned. So none of this, the option will be correct here. Next question from general Hindi question. That is you need to find opposite word. उत्तम का विलोम शब्द है. उत्तम का विलोम शब्द है निकृष्ट, विकृत, अधम, कीर्ति. उत्तम, उत्तम वर्ड का ऑपोजिट विलोम शब्द यू नीड टू फाइंड आउट. ऑप्शंस निकृष्ट, विकृत, अधम, कीर्ति. Uttam means very good or like that meaning is coming. Ati Uttam. So here opposite word Vilom Shabd, that is option C Atham. Uttam word Uttam ka Vilom Shabd hai Atham. One more opposite word you need to find. Shoshak. Shoshak का विलोम शब्द है. शोषक का विलोम शब्द है शोषित, पोषक, पोषक, पोषित. शोषक ऑपोजिट वर्ड ऑफ शोषक. शोषक का विलोम शब्द है. It is related to our nursing topic. That is why I selected this word, shoshak. Protein, energy, malnutrition, and nutrition. In that case, we can find this word. Correct answer is option B. That is poshak. Shoshak का विलोम शब्द और ऑपोजिट वर्ड दैट इज पोषक. (25th last question, that is from general English. Select the pair which has the same relationship. Select the pair which has the same relationship. Here the pair that is pain equal to sedative. Pain and sedative, that is one pair. So like that you need to find the same relationship pair from the option. Comfort, stimulant, grief and consolation, trance and narcotic, ache and extraction. Like same pair you need to find out from option. Pain and sedative, same like one pair you need to select from option. Okay, correct answer here, that is option B, grief and consolation. Means here the sedative that is a drug that provides relief from pain. Sedative provides relief from pain. Same way, consolation provides relief from grief. That is the relation. So that is about today's video. We have discussed 25 questions, and if you have any questions, doubt means you can ask in comment section. I think it is clear for you, and the exam date is nearby, day after tomorrow the exam. So best wishes for all of you. Bye bye. Thank you.